The topic of today's lecture is acute appendicitis. The objectives of my presentation are that by the end of the lecture, the students of final year MBBS will be able to understand the surgical anatomy of appendix and they will be able to give a management plan for cases of acute appendicitis in 4 out of our 5 cases. Now, regarding the anatomy of appendix arises as a blind outpouching from the lower end of cecum at the site where three teniculi merge near the ileocecal junction. The position of appendix is never constant. The commonest position is retrocecal, which is present in 74% of cases. The second commonest position is pelvic, present in 22% cases. Less common positions are pre and post ileal and subsequent positions. Now, what is acute appendicitis? Acute appendicitis is acute inflammation of appendix. Peak incidence occurs in 20s and teens. Now, what causes acute appendicitis? Mostly the cause is unknown, but in some cases it is due to obstruction caused by fecalith tumor or by worm infestation. Acute appendicitis presents generally with central abdominal pain that later shifts to the right iliac fossa. This pain is associated with nausea and vomiting, anorexia, and low grade fever. This pain may also be associated with constipation or diarrhea, especially if the appendix is pelvic in position. At times, patients may also complain of abdominal bloating. When we examine these patients, these are tachycardic. On coughing, they have pain in their right iliac fossa. When we palpate them in their abdomen, their right iliac fossa is tender. When we lift hand after deep palpation, they experience pain when the hand is lifted. This is known as rebound tenderness. Now, what is Rovsing sign? When we lift hand gently while palpating the left iliac fossa, patient feels pain in the right iliac fossa. This is known as a positive Rovsing sign. It is suggestive of acute appendicitis. And this pain is caused by the movement of inflamed appendix irritating the peritoneum. Now, what is Swas sign? Students, as you already know, that 74% of appendix lie in the retrocecal position. So, as to confirm whether appendix is retrocecal or not, we perform this test. Firstly, hyperextend patient's right hip joint. If this maneuver causes pain, then it is due to retrocecal appendix lying over the psoas muscle. Similarly, there is another sign which is known as obturator sign. If the patient presents with symptoms of acute appendicitis along with diarrhea, then we need to rule out pelvic appendix. And for this, we flex and internally rotate patient's hip joint. And if this maneuver causes pain, then appendix is pelvic in position. This is because the pelvic appendix lies over the obturator internus. And by this maneuver, the pelvic appendix irritates the obturator internus muscle, resulting in increased pain on this maneuver. The diagnosis of acute appendicitis is basically clinical based on history and examination, and it is supported by investigations like complete blood count. Here, total leukocyte count is raised in acute inflammation. Moreover, urinalysis is done to rule out urinary tract infection. Ultrasound abdomen is done only in females of reproductive age to rule out gynecological pathologies like ruptured ovarian cyst and ruptured ectopic pregnancy. CT scan abdomen is also needed in only those cases when there is diagnostic difficulty or diagnostic confusion. When a case of acute appendicitis is diagnosed, the treatment is surgical. The approach can be open or laparoscopic. In open approach, a small incision is made in right iliac fossa and open appendectomy is done. While in laparoscopic approach, three small incisions are made through which three small ports are inserted and laparoscopic appendectomy is performed. This laparoscopic appendectomy is gold standard, provided the facility of laparoscopic appendectomy are available in the center. So, as to summarize my lecture, acute appendicitis is acute inflammation of appendix. When diagnosed, should be treated surgically, and the gold standard is laparoscopic appendectomy. Thank you.